So I do love Lori because she doesn't hit me with a ruler when I have that occasional piece of pecan pie or piece of red meat once a week. She is a board-certified specialist in the oncology nutrition, working passionately in the field for over 20 years, including many years with the Judy Nicholson Foundation. Currently, she wears several professional hats, working in the clinical setting as part of the Endeavor Health System in the north suburbs of Chicago, as well as in the nonprofit sector by coordinating nutrition programs at the Cancer Wellness Center. She also privately counsels high-risk clients and survivors. Lori is co-founder of the Cancer Nutrition Care, a startup telehealth company with a mission to provide trustworthy and meaningful nutrition services across the country for those who do not have the advantage of partnering with a dietitian. Lori is active in her practice group, crafting patient education materials and professional articles which are accessed by professionals and patients. She is a first-time mom of identical twins, God bless you, that turned 3 in October. In her free time, and we may want to ask what free time, she enjoys walking her dogs to Lake Michigan, running half.
I know, I'm a maniac.
I can't even walk to the car anymore. Running half marathons and supporting her husband's brewery in a neighboring town. Lori hopes to teach others about the balance of eating, I remind you of, for pleasure, social connection, and empowering ourselves with nourishing food. Thank you, Lori.
Thank you. All right, thank you, Joel. Thank you for that introduction. How's my volume? Perfect. I love to hear it. I know we're a little behind, so I'm going to do my best to be on time. Do I have a laser pointer? Because I always love those. Yeah. I do. Actually, I'm just teasing. We're just going to go with it. All right. So there's not much more I can add about what I do because of that lovely introduction. Thank you, Joel. But I love what I do. I'm not just a dietitian. I'm an oncology dietitian, and that's how I identify. What I do want to brag for a minute about is my work at Cancer Wellness Center. It's a nonprofit. We have a brick and mortar in North Brook, Illinois, but we serve people in 43 states. So we offer a lot of virtual services, all for no cost. So anyone who is affected by cancer, if you're interested in receiving counseling, support group work, there's a demo kitchen there. So if we have any local culinary talent and you want to partner with me, because I sliced off my thumb last week, I'm a dietitian, I'm not a chef. So I encourage you, the table's still out there, so please do consider services there. It's a tremendous place to work, so I feel really fortunate. Now, I would love to be able to give each and every one of you personal nutrition advice, but I can't. I only have 25 minutes now, probably less, and we're in a group setting. So keep in mind that what I'm about to share with you is really general advice, right? And it's not meant to replace the medical advice that you get from your care team. So on the menu, a little Halloween fun, because I can't help myself. How nutrition and cancer relate to one another. A little bit about side effect management. I wish I had more time I would love to share more about that. And then some resources along the way. So I wonder, what do you think dietitians hand out for Halloween? Apples. I remember as a kid getting like change, like getting pennies and being like, don't go there. Have you seen these mini salads that Dole put out? Just kidding, this isn't real. It would be really like a sin if it were, right? Just a reminder that dietitians, especially oncology dietitians, especially myself, we have this philosophy and practice that restrictions generally backfire. So we want that pecan pie. Have a slice, enjoy it, savor it, because if you restrict yourself, chances are you're going to eat the whole pie, right? So Joel gives a little of this. So we really want to embrace food as being more than just nutrition, right? It's social connection, and it's also pleasure. And that's what I love about what I do. All right, so let's talk a little more about, I'm going to try to project so I'm not leaning. A little bit more about nutrition and its relationship with cancer. So if you didn't know that cancer and the treatments that are used can create a physiologic burden that can overwhelm even a quote-unquote healthy individual's nutritional reserves. So really what I do in clinic on the front lines is I work with individuals during their active treatment, and I'm helping them preserve their weight, preserve their nutrition status. So very much the priority is just to eat enough calories, eat enough protein, stay adequately hydrated, eat your vitamins and minerals, right? Or we might need to supplement them. Now, what I love about what I do is that I remind the people I'm working with is that food is one of the only things that we have control of in this life, right? And so I get to empower people, which is a really cool thing in oncology, if you ask me. Moving along. So there's evidence that dietitians can help for lots of great reasons. So we help to minimize the risk for significant weight loss and malnutrition. We can promote optimal nutrition intake while managing symptoms and side effects. We utilize diet to support kidney function. So we recognize if you're diagnosed with cancer, you're a whole being. There's so much more to you that we want to acknowledge and work with. Love optimizing quality of life, right? Food is pleasure. And if I can return food as a pleasurable experience for those people I work with, I really feel like I've succeeded. I was like, where'd that come from? And I find this increasingly, so I've been in practice for 20 years, so many individuals come to me with having so much confusion about conflicting advice or information that they got, whether it's from neighbors, a well-intentioned family member, they were going down a rabbit hole on Dr. Google, right? Or they're scrolling social media, and they're like, I don't know what to eat, what's left to eat, right? So I help the people I work with navigate all of that mis and disinformation and give them some trustworthy, reliable resources. Okay, so here's where dietitians really shine. We offer comprehensive assessments and unique interventions, right? So we're not cookie cutter, and that's why we are so much better than Dr. Google, right? We also, I would encourage in your situation, if possible, to meet with someone as soon as you can. Meet with that oncology dietitian and do it often, because your status may be acceptable now, but that doesn't mean it's not going to change, right? We also there's a lot of things that we will include in our intervention. We're going to look at someone's treatment modality, their intention of their treatment, the presence of high blood pressure or any other comorbidities, and then also if they have any impaired kidney function. So what do dietitians recommend? This is probably what you're here for. Joel kind of summarized it nicely for me. So we love plant foods, and I'm going to dive a little deeper into why that is in a moment. But we're looking for you to eat mostly whole grains, mostly fruits, mostly vegetables, mostly beans, mostly lentils. If you can do that more often than not, you're eating a nutrient-dense diet, and that's going to support your entire body's ability to thrive. If you do want to have animal foods, they are totally permissible, right? But we encourage them in just smaller amounts. So we're going to look towards low-fat dairy, poultry, fish, eggs, and lean meat. I like to recommend that you cook as much as possible. When we cook, we're more connected to our food, right? And chances are when you are cooking, you're going to eat more nutritious foods, and then you're also going to minimize highly processed foods, which that's kind of all the talk right now, if you haven't already seen that. The highly processed foods that most dietitians worry about are sugary beverages and highly processed meat, all right? Because they seem to be problematic for cancer. So how are we going to summarize, I think, let me back up a little bit. How are we going to make this recommendation more practical for you? So more recently, nutrition experts have been using what we call a healthy plate, because it's a little bit more practical than looking at a food guide pyramid. And I tend to agree with that, right? So anytime you sit down and you're gonna prepare a meal or you're ordering takeout, and you look at your plate or you look at your bowl, this is sort of the structure we're looking for, right? So sorry for the fine print. But most of the plate, so half of the plate, if we can fill it up with vegetables and fruit, preferably non-starchy vegetables, then you're gonna really maximize the nutrient density of each of your meals. And then a quarter of the plate for your starchy vegetables or your whole grains, right? So things like sweet potatoes and corn and peas. And then the remaining quarter of the plate for your proteins. And I almost always remind people I'm working with that protein comes from both animal and plant sources, So we can really optimize some choices there. So this is what it would look like. And I don't know about you, but this is sort of common sense to me. This is a healthy meal, right? I see a lot of color there. I see not a lot of processed foods, not a lot of artificial colors, right? Like it's not Skittles or Lucky Charms. Those are natural colors, and I'm going to talk about them in a moment. And then there's brown rice or quinoa, I'm not sure exactly what that is, and then some salmon. But this way of approaching meals is doable. It's probably easier than you think, and there's a lot of versions of this way of eating. So something like oatmeal with fruit and nuts for breakfast, turkey meatballs with some summer squash and some whole wheat pasta. And there's also cultural applications for this way of eating. So if you like your collards and you like sweet potatoes and black-eyed peas, there's lots of ways to explore this approach. Okay, so why does it seem like I have a love affair with plant foods and the plant-based diet? I have a handful of reasons. I can probably talk about this for hours. So plants are packed with antioxidants and phytochemicals. So if you haven't heard of phytochemicals, there are 10,000 plus different naturally occurring compounds found in plant foods. They are responsible for giving plants their pigment, their flavor, and their aroma. So just like the burnt orange color of turmeric, that's curcumin, which is a phytochemical. That peppery bite of arugula, those are isothiocyanates. You can brag to your family at Thanksgiving about these fancy words too. Let's say it together, isothiocyanate. Those are phytochemicals. And then also that pungent aroma of garlic. Those are organosulfur compounds. Those are all phytochemicals. And what they do is they actually protect plants in nature. And here's like the really magical fun part of this. When we eat those phytochemicals, they transfer over to protect our own immune system. It's like amazing, right? So this is why you'll hear dietitians say eat the rainbow for this reason, right? And then what I do want to encourage is that you stick to the original source and rather than a dietary supplement. The original source is really the way nutrition is meant to be delivered to our body. Anytime we isolate a compound from a food or manufacture it synthetically, it never works the same in a supplement. So do discuss supplement use with your providers, please. Another reason why I love that plant-based diet are plant proteins. So the best sources are, everyone's favorite beans, lentils, soy foods, seeds, and whole grains. I like to refer to plant proteins as protein plus. So not only do you get protein, but you get a lot of other beneficial compounds like those phytochemicals, but also fiber, which I'm going to talk about next, and then vitamins and minerals. So you don't just get protein, you get so much more. And what we find about plant proteins as it relates to kidney disease is that it may reduce inflammation, reduce potential renal acid load, reduce uremic toxins, and all of this combined can help to preserve kidney function. So it's a nice little bonus. Fiber, my favorite subject matter in nutrition. That's no secret. I think I talk about it with everybody. There's nothing fiber doesn't do. It aids in blood sugar control and metabolic health. It helps to regulate inflammation, and it also promotes bowel regularity, in both ways, right? Which we might talk about in a moment. Now, what gives me job security is not a lot of us are eating fiber. How many would you guess? What percentage of us are eating recommended amounts of fiber? And this is what we report, 10%? Yeah, so 1 out of 10 Americans. Probably it's less, because anytime we survey people, they tell us they eat better than they really do. So it's probably a little less. So, I like to show some images because sometimes I think it's easy to think about your fruit. Like raspberry is not only a good source of fiber, it's a great source of fiber. So if you're looking towards fruit and you're looking to mix it up, maybe choose some raspberries. I think they're generally pretty well tolerated. Ground flaxseed is a friend for a lot of people I work with because it's super versatile. You can add it to a lot of the things that you might already be eating. And that's the magic of what a dietitian does. She helps you, or he helps you, make it all taste good. All right, so prebiotics, those are special fibers found in some of our plant foods. And have you heard about prebiotics? Yes, some savvy members, okay. So how we define prebiotics are that they're food for beneficial microbes. So they literally feed our gut microbiome. And there's emerging research right now that it may enhance the efficacy of immunotherapy through the gut microbiome. Really exciting, if you ask me. Super geeked up about this. I could do a whole day talk, but let's have a whole weekend about prebiotics. So where do we find them now, you're wondering, right? So they're highest in onions and garlic, dandelion greens, yes. You can sometimes find dandelion greens in the store. Sunchokes, which are Jerusalem artichokes, and then wheat bran. Now, sometimes people are like, Lori, I don't eat any of those foods. So please give me some other ideas. And fortunately, we do see that some companies add them to some of our functional foods. So a dietitian can help you find them. And experts right now, it looks like they're advising about 5 grams a day. So that can be tough work for someone. And that's why, again, working with a dietitian can be helpful, because we may prioritize other things. And if you're eating and maintaining your weight and your nutrition and hydration, then we might shift and talk more about prebiotics. So just to kind of keep things rolling, the DASH diet, has anyone heard of that? Yeah, so I've presented this often. I think it's a great way to kind of approach eating in more of, a more practical sense in terms of the overall diet. So the DASH diet stands for Dietary Approaches to Stop Hypertension, and it literally does that. So most of the clinical research has found that individuals that follow this way of eating have lowered both their systolic and diastolic blood pressure in a matter of 2 weeks. That's pretty impressive for a diet. And it was developed at the NIH, at the National Heart, Lung, and Blood Institute. And I like to kind of describe it as not really a diet, but more so like a way of eating, like kind of like a set of targets. So we'll set some goals. And this is plant-based eating, basically. So it's lots of whole grains, lots of fruits and veggies, some low-fat dairy, a little bit of animal foods, and then some beans and nuts and seeds and all that fun stuff. At the same time, it's also low in sodium, of course, right? I'm going to talk about that next, but these are the targets, about 1,500 to 2,300 milligrams per day. That's pretty low, by the way. So salt, so 70% of the salt that we eat really doesn't come from our home kitchen. And that's why I encourage cooking at home more. It comes from restaurant food, takeout food, ultra-processed foods. How much do you think the average American is eating per day? If you're paying attention in Virginia, you know this answer. 3,400 milligrams. If you remember what the limit is on that DASH diet, it's like half of that amount, basically, right? So ways to eat less salt, as I shared, using some herbs and spices instead of flavor, but cooking more. And then replacing any or all of your quote-unquote salty 6. So this is thanks to the American Heart Association. They've identified the top 6 sources of sodium in the American diet. There's probably no surprises here. It's soup, sandwiches, pizza, processed meat, bread. Might surprise some people. And then tacos and burritos. So sometimes, again, as a dietitian, what we would do is identify where are your salty 6s? Where do you feel ready to make some changes? Where can we make some substitutions? And subtle changes can be significant. We eat a lot of salt. A lot of times I get this question, and it's the people that Google, right, without asking their doctor. What's a healthy diet for my kidneys? So what Google thinks is you have kidney disease, and you may not. You may not, right? So only follow that kidney diet if you're advised to from your medical team. Our renal diets, as we know them, are really utilized for kidney disease, not kidney cancer. So we don't have any available evidence just yet. Maybe in time we will. Like, how do we merge the two if someone has kidney cancer and then someone has kidney disease? But it's truly all personalized, right? There is no one standard cookie cutter approach. Renal diets can be restrictive, right? So they may restrict potassium when you may not need to restrict potassium, right? So we want to try to avoid those restrictions if we don't need them. Now, regardless of your kidney function, everyone would probably benefit from following these healthy kidney guidelines, right? Eat less salt, eat a healthy diet, maintain adequate hydration. Kind of boring advice, but it's the best evidence we have right now, and it's effective. All right, so just a handful of side effects with my time remaining. Doing okay? So I just wanted to talk about nausea. Often what I recommend for someone who's struggling with nausea, we review what they're eating, and maybe they need to have a little more often small bites of food, even something at the bedside before they get out of bed in the morning. I always assess if trigger is the smell of food. I find that's the case for a lot of people that I work with. And if that's the case, you probably don't want cooked food, which this is where I work with a lot of caregivers who are well-intentioned and making like this 4-square meal, and it's huge and it's cooked and it smells. But you may prefer some of that food in the fridge and taken out the next day at room temperature. You can also choose some choices that are going to soothe your nausea, but this is where we invite nutrition at the same time, rather than maybe saltines and pretzels. And there's nothing wrong with those foods, but these may also help bring some more nutrition to your diet. I'm not going to review all of them. You can see. Okay, diarrhea. One of my favorite things to talk about. I talk about it every day with people. All right, so we want to encourage lots of fluids, room temp water, right? Decaffeinated teas, lactose-free drinks. You may or may not benefit to include an electrolyte replacement drink. There are so many products on the market, so I just really encourage you to ask your team. Some of them are very high in sodium, which you may or may not need. Some of them have some potassium you may or may not need. So, and we also don't want to rely only on them. Water is the best choice. And then typically what I find is maybe one of those electrolyte replacement drinks in addition to the water that you're drinking. Okay. And then fiber is our friend, trust me, even as it relates to diarrhea. So there's this type of fiber that we classify as soluble fiber. And what it does is it just adds viscosity, right? So it slows the gut down. And then it also bulks up a loose stool. So here are some of my favorite choices to recommend. Again, nutritious at the same time. So yes, it's not a joke that there's marshmallows on the slide. Marshmallows are a secret weapon for dietitians. I don't know if you've heard that. Very effective in managing diarrhea. We think commercially prepared marshmallows are high in pectin. So if you're a pie maker, that pecan pie keeps coming up. That helps slow the gut down, interestingly enough. Yeah. So fatigue, I think most people, everybody, 100% of the people I'm working with have fatigue. I think meal planning is essential, especially meal prep when you can, and keep those staples on hand. And pre-prepping meals, right? Batch cooking, making freezer-friendly meals. I think this is also great for anyone struggling with food insecurity. That's starting to happen in my area where I live and work. So I think meal planning and meal prepping is a huge, not only just an energy saver, but a money saver. And sign me up for that, right? And then we're going to take advantage of some convenient options. There are some that I find really helpful. And sometimes I revisit sections that people have traditionally avoided because they thought they were unhealthy. And we might look at that frozen section and find some really great nutritious gems that are convenient and also cost-friendly as well. So these are my top trustworthy resources. I recommend them highly. So the J&F table had some printed out of these NCI Eating Hints books. Love that resource. The American Institute for Cancer Research, that's sort of my lifeline, a really helpful soup to nuts, everything you could want to know about cancer-fighting foods and recipes. That DASH diet, really great website as well. A lot of people ask me about old ways, and when I trimmed down these slides to save time, I'm right on time, I took out my Mediterranean slide, because that's another great version of a plant-based diet, and I think it's also representative of a way of living. So I've never had the pleasure of being there, but I mean, they just dine, they enjoy, they eat with others, they cook, and I think that's a really nice way to approach food. And then Cook for Your Life is a great resource as well. If you're looking for symptom management recipes, you can go to this website and literally filter for if you have diarrhea, if you have mouth sores. Great resource. So I often will access that for my patients. I see some cameras up, so I'm going to wait. Do you want me in the picture? All right, so just in summary, if you are malnourished or nutritionally have some deficits, you will not do as well on treatment. So I encourage you to discuss that with your provider, ask for a referral to a dietitian. Nutrition counseling is not cookie cutter. It's tailored, right, to the individual. And eating a whole food plant-based diet really is delicious, easier than you might imagine, and definitely the most cancer protective, if I were to summarize that. So thank you. And just want to share this quote. So Hippocrates, probably his best known quote is, "Let food be thy medicine." I like this one better. Yeah, I love this quote. I wish this one was more known than the "Let food be thy medicine." Really, that's how I approach in a philosophical way my patients. No. I Googled it.
I took that from somebody in Williamsburg.
Yeah, it's a hip.
I changed it.
Yeah.
It was you? Oh, thanks.
That's one of his lesser known quotes. You are welcome.
I
I know.
have it in my office now.
It's beautiful. Yeah, it's beautiful. So thank you all. I think I covered it. Do we have questions? Oh, yeah. Okay, go ahead. Are we just raising hands?
I have two quick ones. How do you know if you're malnourished? And why not ice water? Why room temperature water?
So the first one, I'll answer the second one first. I like to do that. Keep it fun. Anything like extremes tend to not be gut friendly. I find that. Now, again, that's sort of cookie cutter, right? So I think a lot of nutrition tips are generalized. Always experiment. Always test things out for yourself. And if you notice them, a lot of work I do is like mind-body connection. See if something helps you, because like the marshmallows may not work for someone. So we're not going to force that and feel disappointed if it doesn't work, because there's going to be other options. Okay, so we don't live and die by these rules, so to speak. Okay, great question. Malnutrition. So there was a great paper published a little over a year ago, and there are 6 screening tools that determine if someone's at risk for malnutrition. I think the best one is the easiest one. It's 3 questions, and it's called the Malnutrition Screening Tool. You can access it online. It's literally 3 questions. I use it where I am in clinic at Kellogg, so that's our screening tool. And again, if you do not find that you're at risk for malnutrition, it doesn't mean you won't become malnourished. So it's important to reassess and rescreen. Okay, great questions.
Any comments on how to eat healthy while on a TKI? I like a lot of the stuff that I used to eat a lot of the stuff that you mentioned. Lentils was a big thing. Whole grains, and I basically have had to cut that out because of the diarrhea and all that stuff. So can you maybe have some advice?
Great question. I think that your blender is your friend. So like mechanically digesting food outside of the body. So smoothies are really a great way to get some nutrients, right, that you may not otherwise tolerate. But then I always introduce blended soups, because they're sort of like the savory cousin to a sweet smoothie. Like we make smoothies sweet, right? But a lot of people have taste fatigue with that. And you can get some vegetables and maybe even lentils into a blended soup and tolerate that a little bit better. We might get strategic with our ingredients. Like I might put like asparagus tips inside a blended soup, or ground oats inside the smoothie, and a banana, right? Because that probably will be better tolerated. And then you're having those nutritious things, like oats are a whole grain, right? Yeah, great question.
Hi, thanks for being here, by the way.
Thank you.
This is a great symposium, my
It's
first one.
amazing.
Yeah.
Thank you. Yeah.
What I really wanted to ask you about was CBM 588. I saw something, it might have been you,
Yes.
on YouTube shortly after I was diagnosed stage 4. Okay. And it came with a disclaimer of, this isn't medical advice and don't go buy CBM 588. So I immediately went to eBay and bought
Of course.
CBM 588. and I've been on it ever since.
Wow.
I guess my question is, I've also, read a lot about nutrition and that kind of thing, and I really believe in that. So that I don't have to take 67 supplements, I can just eat good food and, avoid a lot of that. But what's special about CBM 588 that we should know about? If you're okay answering that, I know I don't want to get too specific. I know it's a big room, but I know that's a big thing that's going on. So if you could let us know what you think about that, I'd appreciate it.
Yeah, no, thank you for being here. You're referring to a real talk I think we did with Laura. And it's probably on the YouTube channel, so if you don't follow Judy Nicholson, now you should. I'm telling you. And I co-presented with Dr. Pedro His last name escapes me at the moment, but he's doing some active research on this very specific probiotic strain. So my talk wasn't on probiotics at all, but it's not that specific strain, that specific probiotic, I don't think is for sale here in the States because they're in. You got it through Japan? Okay. And just like prebiotics, they're looking at very specific ways to manipulate the gut microbiome for immunotherapy, because the thought is that it may enhance the efficacy of the immunotherapy, potentially the tolerance to the immunotherapy as well. But the dietitian's understanding of that is pretty limited. So I would encourage you, of course, speak to your healthcare, your oncologist or your provider, your care team. It's really exciting, but the gut microbiome is it's such a complicated topic because we all have it's like a fingerprint or a thumbprint. And so I think we have to understand first, like, how do we even understand what your microbiome is? Would you benefit from a probiotic? And not all probiotics are created equal. So it gets really complicated. That's why I share prebiotics, because prebiotics are going to benefit the beneficial microbes and they're harmless. It's like a risk-free intervention. So you can eat all those prebiotics and potentially have some benefit. It's just a matter of time. Do you want to? No? Do you want to bring it up? Our CEO, everyone. Yeah, so it was an open forum, and Dr. Pedro Barada, I think Dr. Pedro Barada, and he's out of Cleveland University Hospital. See, Joel knows. It was a wonderful panel of myself and him, and it's on the YouTube channel. So please, that's just one thing on the YouTube channel. So please check out the YouTube channel if you haven't. Can I endorse JNF anymore than I currently am? Yeah. 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 So in the new year, I also going to be presenting. I actually know the topic: eating well and living strong. A nice little monthly series on nutrition and kidney cancer.
And that'll kick off in January, starting 2026, and we'll do that monthly so we'll have 12 episodes next year. It'll be on our YouTube channel. Third Wednesday of every month. And if you subscribe, you'll get an alert.
Subscribe.
Yeah, subscribe.
Is that it for questions? Yeah. Thank you. Okay, thank you. Oh, yeah. Sure.
Is there anything food-wise you can suggest for the sores?
Mouse sores. Yes. That was a slide, and I took it up too. So thank you for asking that. We're really, with nutrition, we're really looking to be proactive rather than reactive. So the hope is that you're using whatever you need to do to keep those mouse sores at bay. I do find some of my patients that when they up their rinses, even if it's just baking soda and salt and warm water, that they find if it feels like one is coming on, they can keep it at bay, which I find really cool. Yes, and
it melts in your mouth, and then you just
swish it and spit.
But it does soothe the gums.
Yes.
But once one gets going, and then when you're on these meds, it's like you can't. It's like a bad relative. It visits and it doesn't go away.
It's like a bad relative. I'm never going to forget that. Yeah, the best I can offer that I've worked with individuals on getting really thick straws and working those smoothies and those blended soups, probably cooler, right? And then just redirecting away from sores. So that way at least you can get some nutrition, because you're definitely you're not going to want to eat the same foods, and you could risk weight loss, right? So we find that might be helpful. And then using some fats like coconut oil or honey that are really soothing in the mouth and to help kind of calm things down. Yeah.
Great.
Thank you. Thank you.